Let's jump right into this explainer, because today we're putting on our detective hats and investigating a hidden world going on inside of you right now. When you picture your skeleton, it's pretty easy to just imagine a static, unchanging frame, right? But in reality, our bones are incredibly dynamic. They're literally bustling construction sites, constantly being broken down and rebuilt in this lifelong process we call remodeling. And just like any massive construction project, this process leaves behind evidence. So today we're going to analyze that exact evidence by looking at bone turnover markers. Here is our quick roadmap for today. First, inside the living bone. Then, demolishers versus builders. Next, why these markers matter, followed by the chaos of measurement, and finally, finding the true signal.
Part 1. Inside the living bone. So, it's time to completely shift our paradigm here. If you've ever thought of your skeleton as just, dead scaffolding, absolutely throw that idea out the window right now. Your bones are highly active biological tissues, and to track that activity, we rely on bone turnover markers. Basically, these are biochemical substances we find in your blood and urine that reflect the relative activity of two very specific microscopic workers, osteoblasts and osteoclasts. You can kind of think of these markers as the chemical clues, or even like the exhaust fumes, left behind by the heavy machinery working inside your bones. By measuring these, we can actually figure out how fast those bone remodeling engines are running. And the best part? We don't even have to do a biopsy.
Moving right along to Part 2, demolishers versus builders.
To really make sense of all these chemical clues, we have to look at the two sides of the bone remodeling coin. On one side, we've got resorption markers. These are basically the byproducts left behind by the demolishers, the osteoclasts, whose whole job is to break down old or damaged bone tissue. Then, on the exact opposite side, we have formation markers. These are the chemical footprints of our builders, the osteoblasts, which swoop right in to lay down fresh, new bone. A truly healthy skeleton relies on a perfectly delicate balance between these demolishers and builders.
So what are the actual specific chemical receipts we're testing for in a lab? Well, for our demolishers, we're looking for substances with names like hydroxyproline, PYD, or CTX. When we see those spike, we know bone is being broken down rapidly. For our builders, on the other hand, we test for markers like total or bone-specific alkaline phosphatase and osteocalcin. Yep, they're complex medical names, but together they form the essential biochemical ledger of your skeleton's daily activity.
Which brings us to Part 3, why these markers matter. We know what the markers are, right? And we know the cells that make them. But how do doctors actually use this intel to solve the mystery of failing bone health? First off, these markers let us predict bone loss silently long before a catastrophic fracture ever happens. That is huge. They help us identify patients who are at risk for both primary and secondary osteoporosis. But honestly, their most powerful application is probably in treatment. They can actually predict how a patient is going to respond to a therapy before it really gets going. They monitor the ongoing response to those osteoporosis treatments, and crucially, they help identify if a patient on long-term therapy is experiencing an oversuppression of their bone turnover. It's just highly proactive medicine.
But look, not all evidence is created equal. A good or reliable marker actually needs to meet a few specific criteria. For one, it has to show a really clear difference in bone turnover rates between pre- and postmenopausal stages, mostly because that's when bone loss risk just skyrockets for women. It also needs to have minimal analytical variation, which just means the lab test itself has to be super stable. And this is key, it has to measure biological change in a short time frame. We're talking months here, not years. I mean, we really can't wait an entire year to find out if an osteoporosis treatment is actually doing its job. We need those answers fast.
Okay, Part 4, the chaos of measurement.
Now, here is exactly where our little investigation hits a pretty major snag. This biochemical evidence, it is unbelievably sensitive. We've got endogenous variables, meaning internal things like your age, your gender, ethnicity, pregnancy, any recent fractures, immobility, or even associated diseases like liver or thyroid disorders. And then we have the exogenous variables, the external stuff. Did you know your circadian rhythm actually changes these markers? Same goes for seasonal variations, the menstrual cycle, how much you exercise, your diet, and specific drugs like glucocorticoids. Literally, almost your entire lifestyle can tamper with this biochemical crime scene before a single drop of blood is even drawn. And the chaos doesn't stop there. It continues even after the sample reaches the lab. Interlaboratory variations can be absolutely staggering. Check this out. If you send the exact same sample to different labs, the results might not even be comparable. You might see a 30% variation for PYDs, a 39% variation for NTX, and for osteocalcin, a shockingly high 68 to 71% variation. That's wild. Why does that happen? Mostly because different labs are using different immunoassays, different reagents, and they have instability in their calibrants and quality control materials. It's just that chaotic landscape out there.
Let's wrap it up with Part 5, Finding the True Signal.
So with all of this biological and laboratory noise going on, how in the world do medical professionals actually cut through it to find an accurate measurement? Well, the answer lies in a really vital mathematical concept called LSC, or the least significant change. By definition, LSC is the absolute least amount of change that can be considered statistically significant, rather than just some random fluctuation or a statistical error. Because we know there is this immense short-term and long-term variability in people, doctors use the LSC as a super strict threshold. If the marker doesn't move past the specific percentage, we just have to assume nothing has actually changed in the patient's bone health.
And those thresholds, they differ wildly depending on which side of the construction site we're actually analyzing. For our bone formation markers, the builders, the LSC threshold is greater than 25%, so the marker has to change by more than a quarter for us to be confident that it's a real biological signal. But for bone resorption markers, our demolishers, the LSC is a massive 60 to 80%. We literally need to see a huge leap or drop in those resorption markers to confidently say that a patient's bone breakdown rate has actually shifted.
Now, to ensure we even have a fighting chance of hitting those reliable signals, we need strict protocols across the board. In the pre-analytical phase, samples really should be taken from fasting patients right in the morning, ideally collected over 2 to 3 days at the exact same time of day just to bypass those tricky circadian rhythms. On the analytical side, labs must participate in external quality programs to help standardize all those chaotic variations we talked about. And post-analytically, labs need to derive their own reference ranges tailored specifically to their local population so we can actually interpret things correctly.
Now, of course, none of these strict protocols were just invented out of thin air. This whole investigative framework is deeply grounded in rigorous, peer-reviewed scientific literature. The clinical significance of predicting bone loss, classifying resorption versus formation markers, and mapping out all that analytical variability, it's all built squarely on the foundational work of global experts in bone health and chemical pathology.
So what's the big takeaway from this explainer? Your skeleton is not a static object. It's a living, breathing construction site that leaves a highly sensitive trail of biochemical evidence right in your blood. But when you really consider how much things like your diet, your exercise habits, the time of day, and even the seasons can skew these markers, it leaves us with a pretty fascinating question to ponder. Is your daily routine secretly rewriting your bone biology right now as you watch this? Think about it. Thanks for joining me on this explainer, and keep your curiosity focused.